Does marijuana have a place in the treatment of low back pain? Medical marijuana has become an emerging utilization for the treatment of various different types of pain as a non-opioid alternative. My name is Dr. Grant Elliott, founder of RehabFix, and we have helped thousands of people around the world fully recover from low back pain, disc herniation, and sciatica. In this episode number 135 of the Low Back Pain Podcast, I'm going to dissect the utilization of marijuana for back pain, how you should use it, if you should use it, and what the actual benefits and side effects might be. Real quick, if you have not joined my private Facebook group yet, you need to do so. It is called RehabFix Low Back Program, and immediately upon joining, you will receive our free step-by-step sciatica guide. This is the same process that we have taken thousands of our clients through around the world to identify exactly how to fix their sciatica and ultimately become pain-free through a one-on-one coaching program. In this group, you will be able to see our clients and what they're doing for success and additional resources and more free guides. So if you're serious about fixing your back, you need to join this group, RehabFix Low Back Program. See you soon. So can marijuana be used for lower back pain? The answer is yes, based on the current evidence, but I'm going to explain why and how it works and the best way to ingest cannabis for the best effects. In a recent systematic review from this year, 2022, we see that cannabis was found to be effective in the treatment of back pain. But how is it effective? Why is it effective? How should it be used? And what else should you do with it? Let's discuss. The mechanisms of the analgesic effects, or the pain-reducing effects of cannabis, include inhibition of the release of neurotransmitters and neuropeptides from presynaptic nerve endings, which modulate the postsynaptic nerve excitability, activation of descending inhibitory pain pathways, and reduction of neural inflammation. That is a mouthful. Essentially, what this is saying is that the primary pain reduction effects come from reducing neurotransmitters that cause pain or cause nerve excitability, and also reducing neural inflammation. This is through the activation of cannabinoids. And there are three types of cannabinoids, and I'm going to tell you the role of each one. There is a phytocannabinoid, which means plant-derived. There is an endocannabinoid, which means it is endogenous. It is already present inside of us. And a synthetic cannabinoid, which is obviously synthetic, meaning human-made. The phytocannabinoids, the plant-derived, are the ones that provide most of the anti-inflammatory, antioxidant, antispasmodic, which means reducing muscle spasms, that would be good for back pain, and muscle relaxant effects. Now, the endocannabinoids are going to affect the receptors in your nervous system the most. These directly affect receptors that transmit pain, reducing nerve excitability and suppressing inflammation and sensitization to pain. Now, the last type of cannabinoid, the synthetic or the human-made cannabinoids, are broken down into two. One is our dronabinol and our nabilone. Both of these have been approved for the utilization of helping with nausea and vomiting related side effects associated with chemotherapy. So if we were to summarize how marijuana could affect our pain, it's because it affects the receptors that communicate pain and affect the pain pathways, and also the environment of where that pain site is located by addressing the inflammation of that area, the muscle tone of that area, and the excitability of that area. And then, of course, other systemic effects involving reduced inflammation. Now, what is the best way to ingest the marijuana if you're utilizing it for medicinal purposes? They actually found that inhalation of marijuana is superior to ingestion of it. The primary reasons are because if you ingest marijuana, then your body metabolizes it through the liver. If you inhale marijuana, then it is much more rapid and immediate and bypasses these metabolic processes. The primary advantages to inhaling marijuana for medicinal purposes is that it has a fast onset of action, requiring just minutes instead of hours if you were to orally ingest it. Rapid attainment of peak effect. It can reach its peak effect within an hour versus oral ingestion sometimes taking several hours, which is maintained at a steady level for about 3 to 5 hours, while the oral ingestion has a variable effect. This could be observed and last 8 or more than 20 hours in certain times. And the inhalation of it produces less generation of a psychoactive metabolite. Now, of course, I'm not saying that you need to start ingesting marijuana to address your lower back pain. This is just a very hot topic, and we actually get a lot of questions about this. Just today, this was a question I was asked directly by one of our clients in our online low back program who was just curious about this and this potential effect on back pain, since it is such a hot topic, if you will. Medical marijuana is becoming very commonplace and very accepted amongst many different industries and many different regions of the world. So I wanted to voice this in case you are someone who is already partaking in, or who is considering. I just want to provide information, but you can do with this information what you want. If you choose to partake in the consumption of marijuana in any way, that is your own personal decision. But it still is no different than any other passive or adjunct therapy. It will not cure back pain. It can certainly reduce it based on the evidence that we have here, but it's not going to change your movement, your education, your habits, or ultimately what you're doing for yourself to change the function of that area, right? Just like a pain pill will not work. Yes, this is a better alternative to a pain pill, but the application is the same. It helps reduce symptoms, but it does not change your function. So you need to have an appropriate rehabilitative plan to go along with this if this is a route that you are currently taking or have interest in taking. You must have a rehab plan in place. You need a proper evaluation. You need to know the exercises to do. You need to have a consistent plan every single day because you have to do the work. You cannot sit back and simply smoke a joint and expect your life to change from a pain perspective. It just won't work. Now, if this is helping you currently manage your condition because you're having a hard time finding a successful route, then I'm happy for you. I'm happy for you finding anything that helps your current situation. But the ultimate holy grail of back pain recovery, disc recovery, sciatica recovery is education and exercise. The right education, the right exercise, the right plan. So if you're struggling to find that right plan, this is exactly what we help people identify around the world through our online coaching program. And we can take you through our same process to help you find what you should be doing, what you should not be doing, and exactly the steps you need to take to ultimately get pain relief. Once again, be sure to join my Facebook group, RehabFix Low Back Program, so you can get additional exclusive content and our free sciatica guide immediately upon joining. And you can look at the additional upcoming content that we're created just for individuals in that page. It is a great way for you to join a community of serious, intentional individuals, and you can get to see some of our clients winning as well, so you can get a real idea of what is possible for you. If you are watching this on YouTube, please like, comment, and subscribe. If you are listening on your favorite podcast platform, please leave a 5-star rating and review so we can grow this podcast and help reach more individuals who deserve to get results, who feel like they're spinning their tires and getting frustrated in doing so. As always, move more, move in nature, move in the sun. Thank you so much for listening and have a great day.